Hello, this is Dr. Stanley Lang, and welcome to this video. The subject is on gastroesophageal reflux disease, otherwise known as GERD. And I'd like to tell you a story about a patient that I saw today that might be instructive for you. This patient has had a long history of pretty bad reflux, and he'd actually had the surgery for it, which is something that I won't get into detail, just to say that it was bad enough they actually had surgery to try to fix it. And years later, he still has symptoms. Now they're diminished because he has had the surgery, which basically physically helps to block reflux from happening. But he has learned on his own the dangers of the drugs that are called proton pump inhibitors, otherwise known as PPIs. Prilosec is the most well-known of this. Omeprazole is its generic. And the problem is that these drugs work powerfully well to decrease acid in the stomach, which decreases the symptoms. Doesn't decrease the reflux. Reflux is still happening, but it's just a lot less acidic. It's a lot less irritating. And so people feel a lot better, so they keep taking it. And the problem is, the longer you take a PPI, the more you build the dam, that when you try to stop it, it's like the dam is burst and the acid pours out and causes so many symptoms that the person restarts the medication to get symptom control. Of course, this is a really good marketing system for the drug companies. When the PPIs were first invented, so to speak, they're strictly for short-term use, and now they're basically marketed as permanent use medications. This is devastating to us nutritionally, because when you suppress the acid that much, it really affects the absorption of multiple nutrients, particularly the minerals. The minerals need to be chelated, and they need acid to be chelated to be absorbed well, and magnesium is critically affected in this way. Vitamin B12 is also affected by this low acid environment that is created by the medicine. Reflux is not a condition of too much acid. It's a condition of abnormal contractions of the bowel, because the bowel's inhabitants, otherwise known as the biome, are way out of balance. And we're eating foods that trigger reflux on top of that. So the PPIs are really bad news for chronic use. Now, short-term use, probably no big deal. Long-term use, big deal because of these nutritional issues. But an area that a lot of people don't realize is that there is accumulating research that these drugs cause what is called endothelial dysfunction. Now, what does that mean? Well, that means that it affects the lining of the arteries. That includes your coronary arteries. Now, any other medicine or substance that has been shown to cause endothelial dysfunction is recognized as a risk factor for coronary disease. So far, this class of drugs has escaped the scrutiny of the powers that be and is still widely used by specialists. But I believe that the writing is on the wall simply by knowing that it causes significant endothelial dysfunction. So if you're on a PPI, I encourage you to start to chart a path towards a different direction. And there are natural strategies that you can do that work really well. And I would say virtually 100% of the patients that I have that follow these natural strategies get off of the PPIs. Now, they may not get off of all the medicine after years of some type of medicine, particularly if they're not willing to make the dietary changes. But I would say 100% of patients who follow the strategies can get off of PPIs. In my practice, which is a family practice, I'm not saying that every patient in the world can do that, or that the average gastroenterologist practice, that would be the outcome. But I do see a lot of people with reflux, as do most doctors, because it's such a common problem. And why we have such a common problem is another story. I just wanted to tell you the story about this patient. Even after having surgery, he is still having reflux issues, but he was wise enough to know that PPIs were a bad option. He'd done his own reading. I encourage you to too. I wish you well. God bless, and have a great day.